So thank you so much for the introduction. So, my name is Sabah and I'm a first year PhD nursing student. So today I will be presenting one of the scoping review that we conducted as part of our team and under supervision of my supervisor, that is like Dr. Salima Meher Ali. I'm not able to move my slides. Okay, sure. Okay, great. So adolescence and early adulthood, which we usually say 15 to 24 years of age, are critical phases of development. During these years, young people undergo significant physical, emotional, and social changes. They are navigating the challenges of identity formation, academic pressures, family dynamics, and increasingly complex social relationships. All of these transitions can create a lot of stress and uncertainty among youth. So, unfortunately, these issues can sometimes be overlooked or misunderstood. So, particularly as young people are already struggling with so many other changes in their lives. So, the mental health challenges, for example, the depression, anxiety, post-traumatic stress disorders, like it may be like due to any reasons, due to like ongoing challenges in their lives. So the research says that approximately 50% of young people are already grappling with mental health challenges before the age of 15. As they move into their late teens or early 20s, that number grows dramatically to 75%. The transition from school to work, greater independence, and increased expectations can all compound the mental health challenges they face. So, this is where safe spaces play a crucial role. These spaces, whether in community organizations, schools, youth clubs, or online platforms, are essential for providing the support, resources, and guidance young people need during these formative years. In these environments, youth can feel safe to express themselves, share their challenges, and connect with others who understand what they are going through. They have access to mental health resources and support in an environment that fosters understanding and acceptance. By creating these safe spaces, we empower young people to navigate the difficulties they face and encourage them to prioritize their mental well-being as they transition into adulthood. So our objective for this scoping review was to identify types of safe spaces that are being used to promote mental health of youth, and also what kind of interventions these safe spaces are using to improve the mental health of youth, and also to assess or like to just explore the outcomes related to these interventions to improve the mental health of youth. So for methods, like we followed the JBI scoping review guidelines, and our research question was, what is the current evidence on the impact of youth safe spaces on mental health outcomes? So we developed our eligibility criteria based on our team expertise and with collaboration of them. So the population that we included was 10 to 25 years old, either it is male or female. And the concept was these safe spaces like youth clubs, school clubs, community centers, online platforms, or anything like that. And the context we chose was global. We included those studies that were only published in English language because we were not having resources for translation of the articles. So this is PRISMA flowchart, and we conducted a comprehensive search strategies across different databases like the PubMed, Web of Science, Scopus, Google Scholar. So we came up with 8452 articles initially, and then 2 independent reviewers, like they completed the title abstract and full text screening of the articles, and the duplicates were removed. So after of this all process, 23 studies were finalized for inclusion in the review that met our eligibility criteria. So studies were excluded if they focused on the wrong population. For example, it was like above the 25 years or maybe like below 10 years or 15 years. So we excluded those studies. And also we excluded studies that was not in English. So this is a sample of data extraction that we used like to extract the data from the articles, and it included details such as like the author, year, like in which country this research was carried out, and the study designs, age, sample size, type of safe space, intervention, and what was the outcome of that intervention. So for the data analysis, we use two distinct approaches for qualitative and quantitative data. So for qualitative data, we conducted a narrative synthesis by thoroughly reviewing the finding across studies and identifying key themes and patterns. So for the quantitative data, we used like the descriptive summaries. And so these were our findings. So our findings like said that there are like different kind of safe spaces like schools, community organizations, and primary health clinics. And like they are very popular in promoting youth mental health. And each of these settings has unique characteristics and interventions that contribute to improving mental well-being in youth. So in our findings, the most common safe space that was used for youth mental health was schools, which were the focus of 18 studies. Schools were highly effective due to their structured environment where youth could regularly engage in mental health support activities. Then community organizations were the second most common type of safe spaces, offering flexibility and opportunities for peer support and community engagement. However, like community-based primary care clinics were the least commonly studied, but they showed promise due to their holistic approach, combining physical and mental health services in a single accessible location. So these safe spaces use these interventions or programs to improve the mental health of youth. So these are the names of some of the programs that are being used. So for example, if we say Friends for Life program, so it was used to build resilience and social emotional skills of youth. And then internet-based therapy and peer support. And also like Build Learning Power. This was a program used for promote resilience and self-awareness through educational approaches. Then there were some like mentoring initiatives that were being taken from the community and school settings as well. Then professional screening and referrals were also available in some of the schools to identify the potential like mental health challenges the youth are facing, and their proper referral like to the appropriate mental health space. And then there was like Safer Teens PC program that was focused on safety, substance abuse prevention, and overall mental well-being. So these were the outcomes of the interventions that were being used. So the interventions in safe spaces significantly supported youth mental health by addressing a wide range of emotional and behavioral challenges. They were effective in reducing symptoms of post-traumatic stress disorder, anxiety, and OCD by providing youth with the tools to manage their emotions and cope with stress. Additionally, these interventions help decrease suicidal ideation and intrusive thoughts by promoting early intervention and encouraging youth to seek support when needed. So these programs also played a key role in lowering aggressive behaviors such as anger and hostility by teaching emotional regulation and stress management techniques. So another important outcomes was the reduction of stigma toward mental health, which made it easier for young people to seek help without fear of judgment. And these interventions contributed to improvement in self-esteem, happiness, and classroom behavior. They also enhanced youth social competence, problem-solving skills, and interpersonal relationships. So we can say that these specific interventions build resilience, strengthened like coping skills, and provided young people with the tools they needed to manage life's challenges more effectively. So this is our conclusion, and I would say this review highlights the crucial role of safe spaces in promoting youth mental health. It demonstrates that creating supportive environments within schools, community organizations, recreational clubs, online spaces can have a profound and positive impact on people's well-being. So by providing a safe and non-judgmental space, these initiatives help youth navigate the challenges they face during their formative years, from emotional regulation to dealing with social pressures and mental health struggles. So given the growing mental health concerns among youth, particularly as they transition through adolescence and into adulthood, it is essential to expand and further develop safe spaces initiatives. So these are my references, and yeah, thank you so much.